if you're listening today, please go and get screened. Get screened. And even women in church, get screened. Get screened.
Yes.
Get screened. You know, okay, one thing I like about women care about their health.
I know, yeah.
A woman who has a headache will go to the facility. When you see a man going to the hospital,
It is bad. This is Kingdom Conversation, a place where we talk about God. This is a place we encourage you. We give you real life stories. We do not present perfection to you, but we take you through the journey of becoming, the journey of finding your purpose.
God has called us in different areas of life. We will be looking at how do we make it work so that we are not burnt out.
In our conversation, we are going to emphasize on those people who are meant to become and also to serve. Yeah.
So welcome again to another episode on Kingdom Conversation. Today we are going to be talking about a very interesting topic, and I am glad to introduce to you that we have been joined today by a very good guest today. So stay tuned. Our guest today, his name is Pastor Adrian Ngaywa. I call him Pastor Adrian because he is my pastor actually in my church. He's a well-dedicated medical laboratory officer with a strong passion for women health, and the combination of ministry and medical knowledge gives him so much understanding of the communities and what the community is actually going through as pertains to women health. And so today we are going to be talking about cervical cancer. And I just want to introduce our guest today. Maybe just tell us more about himself before we can start to talk about this interesting topic.
thank you so much, Salin. I'm very happy to be here. I'm a very good follower of this podcast. Very exciting discussion that is going on with your team, and I'm so glad to be here this morning. Just as you have said, I'm very passionate about the women health. Currently, I'm working with an organization that is concerned about the women health, and it is so good to see women getting helped out there, especially those women who are not able to get access to health facilities. So our work basically is into the villages, in the rural areas where women are not able to get access to quality healthcare. So that is what we do. Apart from that, I'm also a pastor, and I'm very happy. I always say that pastoring is my work, and this other medical field is my job. Because work is always tied to your gift. A job may be tied to your certificates. Yeah, so I'm so happy to be here, and I look forward to a very fruitful discussion with us. Yeah.
Thank you so much for that powerful introduction. And just to start us off, there is somebody out there, maybe they've just heard about cervical cancer, and maybe they don't have an understanding of what cervical cancer is. Maybe from just a definition, what is it? And maybe just in a layman's language for somebody to understand.
Thank you so much. Now, cervical cancer is a cancer that affects the lower part of the uterus. And that lower part of the uterus is called cervix. That is where it affects. And it's caused by a virus called human papillomavirus. So 99% of cervical cancer cases are caused by human papillomavirus. And that is why I always say that cervical cancer is 100% preventable and curable, because the cause is known. The actual cause is known. Most of the cancers that people suffer, sometimes the cause is not known. But for cervical cancer, the cause is known, because a virus that actually can be detected and be able to be treated early before it proceeds to cancer. However, that is not always the case because the cervix is hidden most of the time. It's not something that you can be able to see. And so women tend to realize they have this disease when it is full-blown. Yeah, that's when they realize. But for breast cancer, it's easy to detect early because the breasts are outside, they are external. You can actually feel it and do a lot of, do diagnosis. So some few facts about cervical cancer is that it's the second most killer cancer among women after breast cancer. And then, as I said, it's caused by a virus, HPV virus, especially the high-risk type. So we have several types of HPV, and the most notorious ones are the strain of HPV 16, 18, and 45. So for those who are willing to go do more research on that, they can actually be able to do research and find out that. Now, I want to give us a bit of statistics, especially in Kenya. According to GlobalCan 2022, we have over 5,000 cases, new cases of cancer, cervical cancer every year. And then over 3,000 deaths from cervical cancer every year. And surprisingly, 9 women die of cancer every day. So like today in the morning, when we are woken up, 9 women are going to die. So that is the situation that we are faced with as far as cervical cancer is actually concerned. But the good news is it is preventable. One only needs to be able to do frequent screening so that they can be able to identify this early enough. Most cancers don't have symptoms until the time when they are full grown into very late stages. That is when you're able to identify, those kind of symptoms. And so one of the major causes of cervical cancer basically is persistent infection with the human papillomavirus. That is the most common cause of cervical cancer, that persistent. So in a lifetime, each one of us, especially the women, have already been infected with, at one point in their life, those who are sexually active, at one point they were infected with HPV. But we say HPV is self-limiting. It means that your body can actually get rid of it at one point, especially if you have a very strong immunity. But in those women that probably their immune system is a bit low, the infection tend to persist for a long time. And now that will now cause changes of cells around the cervix, the lower part of the uterus. And that is when after maybe several years, around 15 years or 20 years, then a woman now then begin to get into full-blown cancer. And then after a while, that's when they seek for treatment.
I would want to interrupt you a bit.
Yes.
You have talked about screening.
Yes.
You have also talked about the number one cause of cervical cancer being HPV. And you have also mentioned that what leads to that is persistent infections. And then it's not also possible to really know exactly what it's not possible to detect early because the cervix is hidden, the breasts are very open, so it's possible to detect if there is anything that is wrong. Maybe I just want us to talk about the persistent infections because if you are infected, definitely if you have like an infection, there are things that points to that infection that somebody can say, now I have an infection, I can go. And then when I can go and maybe get treated. And then now when you're talking about screening, I also want to maybe to just explain, even to, there are those people who also do not have like that medical knowledge. Or somebody is in the village, but they also want to like really understand now at what point do I know that I need to go for a screening, and Yes, maybe we just elaborate now from the infection. What are those signs? How do I know that now I need to go for treatment?
Okay.
Yes.
Apparently, when you are infected with HPV, most of the time there are no signs of infection. The signs that you will get are actually the signs when now your cells around the cervix have started changing and they are becoming cancerous. That is now when you begin to realize that actually you have cancer. But when you are infected, most of the time there are no signs that there is infection. So you cannot say maybe I have some headache because I'm infected, or I have some flu or something like that. There are never signs and symptoms. However, one of the best way to be able to know whether you have this virus or you are almost getting into maybe having cancer is when you do frequent screening. And we have different methods available, especially within Kenya now. The most common one that women may need to be able to, and it's the cheapest, available in both private and public health facilities. It is free in public health facilities, but it can be charged in private facilities, of course, because they are profit entities. So we call it VIA. VIA is visual inspection with acetic acid. So what happens in this scenario is that a woman goes into the health facility and request for cancer screening, cervical cancer screening. So what will maybe the clinician or the nurse, what they will do is they will maybe go to a private room with a couch. The woman will lie on the couch, and then the work of the nurse or the clinician is to look in through the vagina into the cervix, and what they are looking for are the changes around the cervix. Yeah, so it's a very simple process. Doesn't take too long. Any woman can be able to access it through the health facilities. I know the challenge with the VIA is that most women feel that it is not, it is a bit intrusive. Somebody is comfortable. Somebody is looking at your nakedness. There's some women who are a bit more reserved when it comes to those kind of issues. Yeah. So they would rather not, go for this kind of testing or this kind of screening. But it's one of the most available in Kenya right now. So any woman can enter into any facility and request for it, because what is required is not very expensive. You only need a medical healthcare provider. You need some gloves there. You need acetic acid. You need a lamp that you are able just to look into, and maybe some speculum, just aiding the opening of the vagina, so that you are able to view the cervix and see whether there are changes. Now, VIA does not look for the virus. It only looks for whether the virus has started bringing changes in the cervix. Yeah, and if those changes have already started, a woman can actually be treated before those changes move to cancer. We actually call it precancerous lesions. Yeah, the lesions before the cancer actually takes place. So if the VIA is positive, it means the woman has what we call precancerous lesion, those lesions before cancer. But if the VIA is negative, it means that the woman does not have the precancerous lesions. So the virus may be there or not, but if the virus are there, they have not been able to bring about the cell changes around the cervix. Now we have another one, which is a bit expensive, but I am glad that SHA is able to cover it, by the way. Yeah, the only challenge we have is that our facilities are not well equipped with the required machines to be able to offer these services, but it is covered in SHA. It's called HPV DNA testing. So what this does is that we actually particularly looking for the virus itself. So it is possible that a provider can go into your cervix, and your cervix is very, very clean. There is no major alarm or changes, but you're actually infected. So the HPV DNA is very sensitive in that it's able now to identify whether you are infected with the HPV virus or not. And so If they go there, there are two possibilities. You are either HPV negative, meaning you don't have the HPV, or you are HPV positive, meaning you have the HPV. And I'm also glad to say that if you are HPV positive, you are actually able to get treated. Yes. So there are a number of treatments that are available which are very comfortable. They are painless treatment. So the treatment of HPV virus is not some form of injection that you are given. I mean, they can either use what we call thermal ablation. They are just apply a little heat in your cervix to kill the cells that have been infected, and after a while, around 6 weeks, you should be good. Probably you are healed, and all those infected cells have been washed out of your system. And then we have cryotherapy, which is just application of cold, something very cold. We call it cold gas that is applied on your cervix. Again, the issue is just to destroy these infected cells, so that after a while, then you're good. Yeah. Then we have another one, pap smear. Yeah, I know pap smear is also a very common one, where the doctor or the nurse or the clinician just goes into your cervix and scrubs your cervix and put them in a slide. They're taken to the lab. Again, this is only to look for the abnormal cells. Yeah, so those are some of the available screening methods that we have currently in Kenya. I know HPV testing is a bit expensive. If you go to a private facility, I think it costs around 3,500 and more. And I know it can be afforded. I mean, people who have the means can afford it.
Yeah, true.
But now the challenge comes when you have to deal with these women in the rural areas, who, one, they don't even have the source of income, even how to eat is a very big problem. Yeah, so what will actually help them is when they frequently go for the VIA. Yeah, if they can't afford the HPV testing, VIA will be able to save their life.
Wow.
Yeah.
Thank you so much for that. So that means the VIA can be done free of charge in public
facilities.
Hospitals.
Exactly.
Yeah, and then also SHA has made it possible for us. So it's important, even that person that is in the village, it's very important that they register for that.
Exactly.
Because nowadays I think it's become so easy.
Yeah.
Now, onto my next question, I would be, how frequent should somebody go for this kind of tests?
Okay.
Yeah.
Yeah, so let me begin. So VIA, basically you should be able to do once a year.
Once a year.
Yeah, once a year is actually enough. Especially based on your previous test. So if your test is always negative, I think once a year will be fine. But if your test is positive, then I think you should be able to be advised by your medical health provider on how frequent you should be able to test. Now, for HPV testing, this will depend on your HIV status. For those women who are HIV negative, they should be able to go free, HIV negative and HPV negative, they should be able to be tested after 5 years. So from the
HIV negative and HPV negative,
5 years
testing.
Yes.
Okay.
So if you're HIV positive, then I think the timeline is between 2 to 3 years. Yeah, HIV positive, I mean.
Okay.
So for the HIV positive, of course, because their immune system is compromised. So usually that virus take advantage of low immunity to be able to start, eating the cells around your cervix. That is why it is important that you do it frequently. Yeah, so I will encourage women out there that go for what is available, what you can afford.
Yeah.
And what you can afford, if you can afford HPV testing, well and good.
Yeah.
If you can afford pap smear, well and good. VIA is available for all. For everyone. I know maybe HPV test, currently we have a provision where a woman is able to collect their own sample. We call it self-sampling.
Okay.
Yes. Okay. So I know it has not been there, but there is an introduction where, the government is also trying to make it available in a manner that women are able to collect their own samples. Usually the VIA thing, the uptake for VIA has been very low. The reason being, women are afraid of going for that, that opening of the vagina and things like that. They are not very comfortable with it. though it's a life-saving test for those who can't afford the HPV testing. And so you can actually be given a tube and a brush. You can collect your own sample in the comfort of your own house, and then later take the sample to the facility. So nobody has seen you, they only see the sample.
So this is something that is currently available?
Yeah,
in
it's
hospitals?
currently available, but the government is now introducing it to public facilities, but it has not been fully rolled out. Yeah. But I know very soon it will be properly rolled out and made available to all women. And I think that will be able to, increase the uptake so that women are now comfortable getting this test done. And if the government can also be able to, just improve a little bit on providing these kind of machines within facilities that can be reached by these women, then I think it's going to be a very good milestone for the women.
Okay, I have a very basic question.
Yes.
You have talked about you've talked about several infections that I don't know whether they're the ones that lead to human papilloma virus.
Yeah.
So somebody maybe out there might be wondering, maybe they frequently get UTI, they frequently get those small infections that that are treated. Can several of these lead to human papilloma virus?
Yeah, so actually HPV is sexually transmitted. And something to take note of is that HPV doesn't affect men. Men are carriers, but it actually affects women. So a man can be infected, but he is actually a carrier of that HPV. But he's able to transmit it to women, to women or to their spouses if they have so. Now, HPV, whether you are infected with UTIs or not, HPV can actually infect you. And probably maybe this other infection may just be some of the risk factors that can be able maybe to make that infection even grow faster. But whether you have those STIs, other STIs, or you have UTIs, you can still get infected with HPV.
Are these a trigger?
Not necessarily. Not necessarily a trigger. Okay. Yeah, exactly.
Okay. Thank you so much for that. Maybe now we move on to the next.
Yeah, so let me talk about some of the risk factors. Yeah. One of the risk factor is living with HIV, of course, because of the low immunity. Another risk factor is, early sexual debut. We call it, being sexually active at a very young age. The reason being, you actually give that virus a lot of time to be able to stay within your system and, start eating your cervix, and later cause cancer. I have seen a 22-year-old with cancer, cervical cancer. But if you look at their history, then you realize that they started engaging in sex even at age 10 or 11. So that can also be a risk factor. Another risk factor can be, there are some use of contraceptive, or especially the pills. And this actually, because of, it depends with the length that you use it. Less than 5 years usually give you very low risk. 5 to 10 years, there is a substantial risk. Above 10 years, then you realize that the risk can actually be very, very high. So it is important that for those women who are using the OC, oral contraceptives, then you don't use it for a long time. Okay. Yeah, probably you can opt for other family planning methods. Yeah, so that's basically some of the risk factors that we actually have.
Okay, I have a question.
And then also maybe having multiple sexual partners can also be a huge risk factor. Yeah, maybe because you can actually acquire different viruses from different people. And I mentioned a few viruses that are quite notorious. They are high risk, like HPV 16, 18, and 45. Now we have over 200 strains or types of HPV, but those are the few that are notorious for causing, cervical cancer with persistent infection. So it's possible that if you happen to have, sexual encounters unprotected with the different people, there's likelihood that you can acquire what we call multiplex infection with the different strains of HPV. Now that really puts you in a very awkward situation as a woman, because if you get all these strains and all of them are aggressive, then the likelihood that you can proceed to cancer is very, very high. Yeah, so that's something that we need to be able to take note of. I know they talk about smoking because, of course, smoking lowers the immune system. So when the immune system is lowered a bit, then the virus can take advantage of that to be able to cause precancerous lesion.
Oh, because smoking lowers the immunity.
Exactly.
Oh, so it's just it gives it like more advantage.
Exactly. So when the immune system goes low, the viruses takes advantage of that, because your body can actually clear HPV. When your body is very strong, it can clear HPV. And maybe just something to mention, especially women who are between the ages of 25 to 49, it is important that you have frequent, screening, because as you approach 30s and maybe into your 30s, your immune system starts getting low. But then as you even grow older, your immune system gets a bit weakened a bit. So the virus can persist in your system for a long time. And it is that persistence that now can lead to, cancer, precancerous lesion, and then after a while, if not screened, then you proceed to have cancer at the end of the day. Yeah.
Okay, I have a question on. You have talked about family planning methods being also a risk factor.
Especially the OC, the oral contraceptive.
Oh, the one that you swallow.
The other ones are okay.
Yes.
Because OC is hormonal.
Okay.
So actually, basically hormonal contraceptives. Yeah.
Adult contraceptives.
Yeah. So OC has been shown to, people, maybe women who are in the OC, their rate of developing these cancers, this infection is high. By the way, the oral must be combined with HPV. It doesn't just be like, you can do oral, but you don't have the HPV, then you're good. But the moment there's a combination of HPV, high risk HPV, and OC, then there's also likelihood that you can actually be able to, develop cervical cancer later.
So it becomes a risk factor if you already have
exactly HPV.
Your HPV positive.
Yeah, that should be very clear, so that people don't think that it is now the OC that causes cervical cancer. There has to be an element of HPV infection.
So it is something that now exposes you.
Exactly.
You're more exposed if you are already HPV positive.
Exactly.
And then you're taking contraceptives.
Yes.
And maybe because when we started the conversation, you mentioned that you mentioned that it is very hard to detect HPV. To detect cervical cancer at an early stage because of maybe the location of the cervix compared to other areas of the body.
Yes.
Now there is that a person who is being, you see, there are these family planning methods whereby it's for a block of 5 years. The oral, somebody has control. Maybe somebody can say, I can stop for a month, blah, blah, blah. But then there is that one that goes for 5 years, and there is that one that goes for 3 years, and I don't know whether there is one for 10 years.
Yeah, for the coil, we call it, most people call it coil.
It can actually
the copper
but all
it
of
goes for 12 years. The culprit here is actually oral contraceptives.
The culprit is the oral.
The oral, and it has to be combined with HPV infection for it now to become a risk to you. Yeah, exactly.
Okay. Now, maybe before we move to the next, I would want to ask, like, you have gone and you have been tested positive for HPV.
Yes.
As you're taking medication, because you have mentioned that it's possible to treat, it's treatable actually when detected early.
Yeah.
How about when it is detected late? And what is the survival rate if it's detected late?
Okay, now when it comes to treatment of HPV, let me talk about HPV. You know there are 2 levels of treatment here. You can treat at the level of infection of HPV, and you can also now treat cancer. So you can HPV at the HPV level, that means you already don't have cancer. So you can be, it's possible that you can be HPV positive, but you don't have cancer at all. So the prevention factor comes in when you are HPV positive, your cervix is very clear, or maybe there's a few precancerous lesions that can actually be treated so that you don't proceed to cancer. And in that area, we have 2 methods, or even some other methods. I'll maybe just mention a few. I talked about thermal ablation, and thermal ablation basically means that for somebody who has got this precancerous lesion, there's an application of heat on the vaginal os, the vaginal opening. You know, the cervical os, not actually vaginal os, the cervical os, because we have the vagina, then we move to the cervix. Now the cervix has got an opening into the uterus. So where the virus starts eating is the cervical os, that cervical opening. So that's where the heat is applied. And when the heat is applied, it's required that a woman should not engage into sexual activities for 6 weeks. During that period of time, it's a healing process. And then the cells that were damaged are shedding off. And those infected cells are actually shedding off from the system. After 6 weeks, you're good to go. You're actually good. So that means that that infection has been stopped from proceeding to cancer. Now, there are scenarios where there are some facilities that can use what we call cryotherapy. Instead of applying heat, they apply ice, very cold, gas. Just apply it there to freeze and destroy infected cells. That is what happens. We have cases where there's another test called LEAP. I will not go into much about it, where you are able to, remove the lesions, the infected lesions, just like a surgery, but you just remove them so that it doesn't proceed to cancer. So if those cells already were beginning to form cancer, then you are actually able to remove them. So for those cases where somebody feels, I have seen women who feels like maybe they have given birth, they're good, and probably they're having some precancerous lesion that they feel can actually lead to cancer. They can opt for what we call removal of the cervix only. So you can actually remove the cervix without removing the uterus. Or you can decide to remove the whole of uterus plus the cervix, what we call total hysterectomy, removal of them. So that depends with the choice and the decision of a client, based on probably what the doctor has seen and may want to be able to, to help them achieve. Now, I don't have statistics on the rate of the cancer death. Maybe I just gave you a few numbers at the beginning. Currently, around 32.8% out of maybe 100,000 women probably have, are dying of cancer. Yes, and I can say this: breast cancer may be leading because there is much data about it, as opposed to cervical cancer. But if we begin to now be more aggressive towards screening women on cervical cancer, then we realize that it may be even be causing more deaths than the breast cancer. Because most women in the villages, and because it has to do with something they call private, most women will be hiding, and then later dying in the villages. And by the way, I deal with the communities. We go to the community work and just engaging the women. Then you realize that there are women who are hiding silently deep in the villages. They have these, periods that never end. And for many, they think maybe they have a problem with their period. Probably they're thinking, oh, maybe I'm just having a prolonged period. But after a while, they start having maybe pain, and maybe they think, oh, this is normal for a woman. But I always say that pain is not normal. So anytime you have pain anywhere, it should be able to be checked. I know later we'll be able to share a bit of some of the signs and symptoms of actually full-blown cancer, how to identify that, so that somebody can be able to get to know what actually really happens.
Wow.
Yes.
Thank you so much for that. I think that was so elaborate.
Exactly.
Yeah, and also it's an eye-opener for somebody maybe out there. You might be wondering, like, what's actually, what is my body going through?
Exactly.
You're able to now place a finger on that. Yeah.
Let me talk about prevention.
Yes.
As the saying goes, prevention is better than cure.
Yes.
And it is important that then women get to understand some of the prevention services available. One of them is HPV vaccination, and this is for teenagers between 9 to 14 years who have not engaged in sexual activity.
It's been happening in schools, right?
Yes, happening in schools. And so if you are a woman there or a father there watching this, if you have a teenager, please make sure that they're vaccinated against HPV. Yeah, and it's more effective when the girl has not engaged in sexual activity. But the moment that has happened, I know there's a window where probably somebody between 15 to 26 can get vaccinated, but it may not be effective, especially if they've been sexually active. So it is more effective for the girls who are between 9 to 14. And the good news is that these services are available in local health facilities, and community health promoters, or formerly we call them volunteers, they are now moving around together with the nurses in schools, and they are vaccinating girls. The vaccination is safe. You only need 2 doses of up 6 months apart, and that girl will be safe for life. But if you have been engaged in sexual activities as a woman or as a lady, then the test I was talking about previously are actually available for you. The HPV test, the VIA, the frequent VIA screening, and the pap smear are actually available for you. Those are available ways to know whether you have this virus or whether you're beginning to form this cancer or not. So make use of the available tests so that you can be able to save your life. Yes. So that's very, very important to take note of. I want to maybe talk about some of the symptoms of cervical cancer. How do you then know that you have cervical cancer? Though I would really encourage women out there, if you're listening today, please go and get screened. Get screened. And even women in church, get screened. Get screened.
Yes.
Get screened. You know, okay, one thing I like about women care about their health.
I know, yeah.
A woman who has a headache will go to the facility. When you see a man going to the hospital,
it is bad. It has gotten bad.
Men have what we call poor health-seeking behavior. Akona headache, they just umekaa tu anajikaza kama mwanaume, but you know that is very dangerous. But women, they are very curious about their health, curious about their body. But surprisingly, there are women who are not very curious about their body. They are very quiet. They are not concerned about their health, which I find very disturbing. Yeah. So one of the symptoms that you actually have cancer, before you actually have cancer, you get to the cancer stage. There is no symptom most of the time. Yeah, the time you are having symptoms of cancer, you actually have it. You're already maybe in some stages that are going towards, very bad stages. So there is what we call abnormal bleeding. Abnormal bleeding, maybe a woman bleeding in between periods. You will also find a woman who is in menopause bleeding. That's abnormal. So if you're out there, you're already in a menopause stage and you find yourself bleeding, don't take it for granted. Go for a checkup. It may be something that is of concern to you. So please go there and get tested. Now, bleeding after sex, that is also a pointer that something may be wrong with your cervix. So don't take it normal. Some people will say, oh, maybe mzee aliingia sana. No. You can't say that. Make sure that you go for a checkup. Then sometimes you can have unusual vaginal discharge that is bloody and maybe foul odor. When you see that, go for a checkup. It may be some other STI, but don't just keep quiet and say it will go away. There are some people who go to over-the-counter, drug medication, and they're thinking they're treating maybe chlamydia or treating a candidiasis. I know candidiasis is very common among women. And they go for these kind of pessaries. They insert by themselves quietly, and the thing is not going away. So please make sure that whenever you experience vaginal discharge that is abnormal, go to the nearest health facility, let the doctor or the nurse or the clinician check your cervix, just to make sure that it is not the problem. Yeah, so that is very, very important to take note of. Pain during intercourse. Sex is not supposed to be painful.
Yes.
So when there is pain, then that can be a pointer that there's a problem somewhere. So when you experience that, please share with your spouse, and you can go together to the facility for checkup. Especially for those men who are willing to accompany their wives. Yeah. It's very, very important. Male involvement. So I talk to those men out there, please support your wives. Yeah, don't just stay at home and maybe they're having all these issues. Yeah. Please support them. And then we have, pain around your pelvic area or back pain. Okay, so maybe some women will say, inaonekana nilifua sana. Okay, and that pain is very persistent.
The lower abdomen.
Yeah, I mean back pain.
Back pain.
Okay. Back pain. And sometimes maybe you think maybe house chores has brought it. Yeah. I know there are some scenarios where because of the nature of the things you do maybe at home, you can actually experience a bit of fatigue and back pain, which is fine. But if you notice that it's persistent and combined with these other symptoms I'm talking about, then it is high time that you go to the facility for checkup, so that they just rule out, whether it's a cancer thing or not. Yeah. Yeah. So that's very, very important to take note of. There's also increased frequency of urination. Yeah, when you frequently want to go out and urinate. Something about urination. Urine is also part of, is a protective, it's supposed to protect you. I know people have never known that. Urine is protecting you. It's an immune, function. It's a good immune protection function. So when you frequently urinate, it means that your body is trying to get rid of a foreign thing that they have noticed around your vagina, so they're trying to get rid of it. That is why if you have a UTI, you realize that your urination, ama STI, urine kama inakuwa mingi. So urine inakuanga na salt. That salt is able to destroy bacteria and also viruses. That's why and also try to get rid of that foreign, agent, microbes that is disturbing your system. Okay. So if you have that frequent urination, I know there are other indicators that have frequent urination like diabetes, but then please go for checkup so that you can be able to rule out whether it's diabetes or maybe some other cancers or maybe other STIs.
Something else.
Yeah, exactly.
Okay. Then there is urination, maybe you've just taken water.
Yeah, that is normal.
That is normal.
That is very normal. So this kind of urination I'm talking about may not actually be the time you have taken water. You just feel the urge
all the time.
And you all the time, and you're always in the loo, and saa zingine si tunatoa urine mingi sana kidogo kidogo because actually hakuna maji.
So much information, so much insights around that. Yeah. Anything else maybe you would want us to know about this disease?
Yeah, I just want to let the viewers know that it is preventable, 100% preventable,
100%.
and 100% curable, because the cause is known.
Yes.
And so frequent screening among women. And I want to request the women out there, please, sambaza video. wanawake wapate kujua, so that they can go out there and they start getting screening. Finally, to those who are believers, yeah, I know when I was growing up in the 90s, there used to be preachers who used to preach against hospital. They did a lot of it. I remember a story back at home in my village of a pastor who, preached about against hospital to the congregation, that, when you go to the hospital, you lack faith. And you're a sinner. I mean, and one day, pastor got a very serious diarrhea. And he was taken to the hospital. 3 days, alipona. I know. And he came back. And good news is that he never preached against hospital again. So going for checkup is not lack of faith. Yes. As a matter of fact, by the way, God is the one who has given doctors this kind of, human being, this kind of, knowledge. Yes. It is for the purposes of making sure that humanity is staying protected against infection. And even if you look at your body is fighting infection every day. And it is God who has put those kind of mechanism in your body to be able to fight the infections that come into your system. As a matter of fact, I remember somewhere in the book of Matthew chapter 9 verse 12, when Jesus said that that those who are well have no need of a physician, but those who are sick. So physician is a doctor. Yes. So it's only so it means even Christ agreed that even as a believer, you can actually go to the doctor. Yes. One time I had one of the fathers of faith saying, "Don't die the death of a fool in your house. Go to the health facility, get screened, and pray for your healing."
Wow.
Yes.
Excellent. Thank you so much for that wonderful conversation that we had. I think I'm more empowered with so much knowledge.
Exactly.
And maybe just to somebody out there, if the signs and the symptoms that have been talked about, maybe you know somebody that is going through that, or maybe yourself you're going through that, please ensure to take precautions on time, because it is actually 100% curable and preventable.
Yes.
Ensure to share this video. Let us reach out to as many as possible so that we are able to arrest this disease. Thank you so much. Until next time. Bye. This is Kingdom Conversation, a place where we talk about God. This is a place we encourage you. We give you real life stories. We do not present perfection to you, but we take you through the journey of becoming, the journey of finding your purpose.
God has called us in different areas of life. We will be looking at how do we make it work so that we are not burnt out.
In our conversation, we are going to emphasize on those people who are meant to become and also to serve. Yeah.